Well, good morning to Clarion Connection. I'm Ron Wilshire, and my guests today are Rosemary Nachtwey, a retired nurse, and Stephanie Wilshire. Yes, I do know her, and she is the executive director for the Clarion Area Agency on Aging. We're going to talk. I'll give you a little bit of background on what we're going to talk about. The state of Pennsylvania recently combined all federal waivers, including the aging waiver, which serves the largest number of people. And this is basically for people who could be in a nursing home but wish to remain at home. These are people that have to be certified by a doctor and be eligible for medical assistance. The federal government gives 60% of the budget for nursing home care to the states, and the states can apply for a waiver. So instead of going to a nursing home, people can, if they qualify, receive care at home. The result is a loss of $201,000 to the Clarion Area Agency on Aging. The care management has been removed under the new program instituted by the state rather suddenly and replaced with service coordination. Now, nurses who helped with care plans and could visit to check on these people were removed from the new service. So that's quite a elimination from the program, not only financially, but the services that were available before. And the nurse worked with the people after they'd been certified and ongoing. And the nurses could educate families, advise preventative care, head off problems before the hospitalization or nursing home placement. So it was kind of a good deal for all around, because nursing homes are quite a bit more expensive than home health care. But we wanted to talk to Rosemary today, who's been a nurse forever.
You're right there, Ron.
Right. And not you're telling ages, but
No.
you're...
I'd qualify.
You qualify. You'd qualify. But as in your role as a nurse over the years, I know you've been in various areas. You'd mentioned before the program that you actually worked in nursing homes too, and then you worked for this care management part of the waiver. And we just wanted to talk about the human aspect of what was offered under this program and some of your experiences with, obviously without naming names. So what do you remember a lot about the program that you were in?
Well, first let me tell you about nursing home. What I did in the nursing home was, one of the things was admitting the patients to a nursing home. If you've ever seen a scared child, you see a scared adult who going in and thinking, this is it. I'm never going to get out of here again. This is going to be my home forever. So when I was approached by Stephanie to come into the waiver program, which first started, I can't remember how many years ago was it now? Because I worked for you forever.
It's been about 12 years.
Yeah. When it first started, and Stephanie called me and wanted to know if I would consider doing this on a part-time basis. And I said, sure, I'd love to. So when it got started, I would go into the home and assess these people. Now, keep in mind, we didn't accept everybody. You had to qualify for nursing home care, and income was involved. If you could afford your own care that you were given, we could not give you care. And if you did qualify, we assessed to see how much care you needed, what your physical condition was. Now let's go back to nursing homes again. And can you imagine an elderly person who can't take care of themselves but are very much with it? They can make their own decisions and that sort of thing, but they can't care for themselves. This allowed them to stay in their home rather than go into a nursing home, much cheaper, much cheaper than having to go into a nursing home. They had the nurse that could come in and assess them. Now, let me give you some examples of that. One time I had to go in to visit a particular client, and I couldn't get in. And I thought, well, what am I going to do now? Well, found that there was a window open. So I climbed through the window, got in to see the gentleman and get him taken care of. And I also found out that the care he was living with his son, the care that the son was giving was adequate for what a young son can do, but it wasn't adequate to take care of this gentleman who had diabetes, had both legs amputated. He was very grateful, especially since he'd messed the bed and I had to clean up the bed then too, which was not one of my duties, but my goodness, I was going to leave him lying there in a bed all messed up. And climb back out through the window.
She came in through the bathroom window.
Yeah, right. And I tell you, what is the satisfying work of being a nurse or being a health care professional is when you finish your care and somebody says, thank you. I feel so much better. And that is what this gentleman said. They also are happy to know you're coming. There are many, many times when I'd go in the home and say, oh, I've looked forward to you coming. And they'd tell me their medical conditions, which they couldn't get to the doctor unless they had transportation from the county. And they'd say, oh, well, I can take care of it, or the nurse will come and help me. And so when we got there, we would take their vital signs, assess their body, see what extra care they needed, if there was any, and listen to what they had to say. They're more inclined to talk to us about their situation than they were to talk to the caregiver. These people did spend some of their time by themselves if they could, but they do in nursing homes too. You put them in the bed, and they're there, and they don't have a professional around all the time. But they did have someone there at the home that could come in and help, or was there to help during the day, provide their meals for them. What another situation I had was I got a call from one of the case managers that they thought this gentleman who lived, in a bad situation, but wouldn't leave there. He thought he'd been bitten by a rat. So I went out with a case manager to look at this gentleman, and he was a funny gentleman, and I did get to like him. I said, well, come on, let me look at your leg. And as I'm leaning over, looking at the leg, and keep in mind this is in squalor conditions, he said, all of a sudden he yelled, look out. I jumped a mile. And he thought it was so funny. But let us say to him, you're going to have to go to a nursing home because you really can't take care of yourself, and your daughter can't take care of you either. And he'd say, I'll die first. No. And he can make that decision. You can't force someone to go into a nursing home, but you can give them care to keep them at home. That's what every elderly person wants. They want to be able to stay in their own home with their own surroundings and their own valuable things. No matter what the situation is, that's what they want.
So you've had to deal with soiled linen and rats. Snakes. Snakes
also. Yes, snakes also. Another situation I had was a couple, and both of them were elderly. And she was in a wheelchair, and he could not get around and had bad blood pressure situation. And I went in there one day, and the husband said, "Oh, I'm so glad to see you here. Would you please take her blood pressure? I think there's something wrong." Well, sure enough, there was something wrong with the blood pressure, and I was able to contact the doctor immediately and get care for her immediately, and yet she could still stay in her home, and this she enjoyed, as every one of us would enjoy.
Right. Have you ever felt in danger outside the, rats biting you in your job?
No. I was in some pretty horrible situations, areas. But you know what? This is the way they wanted to live. It wasn't that they were just happy, not unhappy with the way they were living. This is the way they wanted to live. and the situations were not good. But no, I never felt threatened ever or scared.
Do you know if everyone qualified for the this service was being served in Clarion County?
This goes by referrals, and lots of times families who wanted to keep their loved one at home, but they had to work, would call to get help for them. We would go out and assess them. As I said, we didn't accept everybody because if you didn't qualify for medical assistance, or if your income was too much, then we couldn't serve you. We could advise you, and we always did that. We never left anybody unadvised.
But a doctor had to approve this person too.
And a doctor.
Welcome back to
very
Clarion
often
Connection. I'm Ron Wilshire, and my guest today is Rosemary Nachtwey, a retired nurse that worked with the Clarion Area Agency on Aging, and Stephanie Wilshire, Executive Director of the agency.
What do you miss
before
about,
we
about the job?
broke, you were talking about some of the various duties that you've had to undertake, and I heard a good story over break. If you want to talk about that.
Well. Now this has got to be at least 15 years ago. It was discussed at the hospital that we weren't getting to the people. People weren't getting the help. So I came upon this idea that we could get lifeline into Clarion County. Now we have 3 or 4 of them, Stephanie. Yes, and so. They said, oh, that's fine, but who's going to install them? Well, guess what?
And Lifeline runs through a phone wire?
Through a phone line, right, that goes to, at that time it went to the hospital, and they in turn then got help out to the people. And a good example of that one is there were people in Clarion that had heard about this program and said, hey, could we get this for my mother? My husband and I would like to go to Arizona for a few months. I said, sure. So I went out. She lived in the country. They had not the modern phone connections that you have in homes today. And so it was doing wiring as well as installation. And got it in, said goodbye. The next day, her daughter and son-in-law took off for Arizona. I found out the day after that, went in and said, here's this patient. She's the patient I put the lifeline in for. So I went up to see her, and she said, I said, what happened? She said, well, I went to get out of bed last night, and I fell and landed between the bed and the dresser, couldn't get up. So I pushed that lifeline. And guess what? They were there in a very short period of time and got me here. And she said I had to have my arm operated on because she had broken her arm. And I said, well, I'll call your daughter. And she said, no. That's why you put that in. Don't you dare call my daughter. So the daughter never found out about the mother's arm until she got back from Arizona. Now, to try to finance this program, I had a limited amount of money. So what was I going to do in order to get enough services in there to be able to get this into the county? So guess what? I called the Area Agency on Aging, and Stephanie Wilshire answered, and I told her that what I would like to do and what she thought of it, if they could help. They did, and due to the fact that they could buy some of these apparatuses, and the ones that we could buy, we were able to furnish it in Clarion County. Now, that was the only one in Clarion. Now, there are 3 or 4 different areas that they can go to get Lifeline. It's great saving grace. In fact, Ron, my children think I should have one.
What goes around comes around. Well, thank you. Stephanie, I want to talk a little bit about what happens now. A $201,000 cut to your budget. What does this do to your programs? And I know this waiver program is a small part of your program, but I'd like to know what it does to it and then how you've had to respond to the cuts.
Well, first of all, I'd like to say that the waiver program is a small part of our agency. It's very labor-intensive and time-consuming, but we serve about 70 people, keeping them out of nursing homes. We still have our options program, and we have care managers that still make visits, and we still are allowed to use nurses in that program. It's funded by the lottery. Unfortunately, I have not had a raise in that program in 8 years, so we were already financially trying to cut as many corners as we could. But I still have a family caregiver program that helps families with, they make the purchases and we reimburse them. And my care managers are very busy with home-delivered meals, and we also provide personal care and some of the same things a waiver person would get. But a lot of times these people aren't eligible for waiver, but they have the same physical needs and the same illnesses, the same conditions. So we try to do as much for them as we can. Also, it must be noted that anybody in this situation who could be in a nursing home and has to go to one because they don't qualify for waiver spends most of their assets within that first year. Over 90% of the people in nursing homes in Clarion County have to have some form of medical assistance to remain there. So I don't want people to think that our agency is, it's a part of our agency that's had a great change. We still have care managers in that part, but now our care managers in waiver who are allowed to pretty much go in, call people, contact people, have a nurse drop by at will to keep things going and keep care plans going are now called service coordinators. All the waivers for disability, which is people under 60, and the aging waiver, which is the largest, 18,000 people statewide, are now service coordinators. They have a limited amount of time that they are allowed to spend in the home with the consumer and working. It's geared very, very much to younger people with disabilities rather than older people with chronic health conditions. We're very, very concerned about this. Our service coordinators and their supervisor and all of the folks in my office, human resources, finances, everybody, is trying to find a way that the service coordinators can still maintain the level of service that those 70 people got and not compromise it. But without the nurses, we're very, very concerned because the nurses were a great way to prevent somebody from going to the hospital. Well, as an example, we're still doing it until July 1. One of the nurses came to me yesterday, and we were talking about one of the consumers, and she had gone out to see them. And the person apparently had a serious, I'll say pneumonia, I'm not sure what kind of respiratory infection. And the family had been trying to get them to go to the hospital or the doctors, and they couldn't get into the doctors. So our nurse went out and talked to the lady, explained the situation, listened to her heart, and said, you have to go to the emergency room. It's imperative that you get immediate care. And the lady looked at her and said, oh, well, okay, you said so, I'll do it. So we have a nurse that actually probably prevented an older person from having a bigger problem, a bigger health problem.
So how has your agency dealt with the cut in the budget? Even though it's a small part of what you do, you've had to respond to this cut, right? Right.
In terms of that $201,000, our service coordinators now have to bill for the hours that they spend with consumers, and we don't expect to regroup $201,000.
But they bill to where?
They bill to Promise under medical assistance, HCSIS. Okay. This is a Department of Public Welfare program that Aging has always had an agreement to provide, and now it's back into the Department of Public Welfare. Unfortunately, what I have had to do is eliminate a staff position. There have been pay cuts. I've had to even eliminate some of the time in my senior centers. So just about everybody in the agency has been affected by this. But we do have a great group of people who are dedicated and who do not want to see older people put at risk. And we're very concerned about this. Our Protective Services Unit, which goes and deals with elder abuse and neglect, is very concerned that without the nursing interventions and the help that we have there, some of these people are going to be put at great risk and require some sort of intensive, leaving the home or something like that. Very traumatic. So we're getting ready. We're gearing up. We're hoping to keep things going as they should go and not have a horrible effect on our seniors in Clarion County.
Is there any clue on where the money went?
That's a good question. We're supposed to be saving money, and this is supposed to save money. But when you talk about a nursing home being $6,000 or $7,000 a month, and us paying 45% of less than that, actually, I guess the state will see savings. That's the whole point of it.
Great, Rosemary, you were going to add something.
My big concern is quality of life for the elderly. You want the best of life for everyone, but when you get older, why should you just have to lie there and figure out that this is the end? You need some quality, and they have that when they're in their own home. Great.
Now I understand through a reliable source that the Area Agency on Aging went private nonprofit last year. This makes for a tough transition.
Well, believe me, it wasn't any part of my planning that we would lose 13% of our budget our first full year out. The advantage we have is that we are not civil service any longer. We are able to do fundraising because as a county entity we weren't, and that's government. That's all government. It just isn't this county. What I do understand is other county agencies are having to lay off people or have opted not to do the service coordination piece. My staff, I think, would never want to leave those 70 people kind of out there hanging, not knowing what would happen. So I think we have the flexibility, and we have a wonderful board of directors who's taken a great interest and spent time on this. So I believe we have a great group of people working that we're gonna make it right.
Right, and a significant portion of your budget comes from a state lottery?
Yes, that's correct.
And the proceeds of the lottery are all restricted for aging programs?
Well, they are. The Department of Aging was formed in 1979, and then under Governor Thornburg later in the 80s, it was made, the lottery was made to fund it. And so Pennsylvania's been a leader in the elder care field because the lottery was doing things that the waiver didn't come till 15 years later to do. So we were already kind of in that mode. The lottery right now, it provides for transportation, senior centers, meals, a lot of the other things. But lately, the latest governors have opted to take $50 million out of the lottery to help out the nursing homes. Not everybody in a nursing home is over 60, and is one issue.
So you have financial questions all around, but without the lottery, it would be an entirely different question.
Exactly.
Right. Well, there's one burning question left in my mind as we face to the end of it, and that's from Rosemary. Are you going to be offering training for these new service providers to how to go through a bathroom window?
I would be happy to. It does take training, let me tell you.
I'm sure there's a state course for it. Add continuing education credits with it.
Yeah, that would be good.
So.
I'm looking for something to do. I'm looking for something to do in the healthcare field, even though I qualify for services.
Okay. Well, maybe you should get on Trading Post that follows us and, tell people this. I think it'd be good. I want to thank both of you for joining me today on Clarion Connection. Rosemary Nachtwey, a retired nurse with the Clarion Area Agency on Aging, and Stephanie Wilshire, Executive Director of the Clarion County Area Agency on Aging. Join us next week for Clarion Connection.